There we go. Hi, I'm Sharon Baker, and I have with me Manny Castañeda, from the Director of Community Health for New Brunswick Tomorrow. And Manny is also the community lead for New Brunswick Healthy Housing Collaborative. And he's been involved in that for quite a while, but he is a representative of one of the grantees as part of the Robert Wood Johnson Foundation grant that we received, a statewide grant that is for Rent for Health Equity. So with that, I just want Manny to talk a little bit about what you were doing before this grant started, that created your base that we've been working with from the beginning of the grant.
Great. Thank you very much, Sharon. And definitely want to start off by saying that we are more than happy to be a partner here at the Rent for Equity grant. I think we've got a lot of work ahead of us, but it's also shown us that the need for something of what we're doing to affect housing policy for the betterment of both the local and the state with respects to residents. A little bit about the New Brunswick Healthy Housing Collaborative. It is through a Build Health Challenge Foundation grant that we have. This is with New Brunswick Tomorrow serving as the community-based organization lead for the project. But we also have other core partners that I want to recognize. And number one, our healthcare partners, which is Robert Wood Johnson University Hospital and St. Peter's University Hospital, and our public health partner, which is the Middlesex County Office of Health Services. And so in a nutshell, the work that we've been doing prior to Rent and continue to do is really looking to affect the local policy around health, right? With a focus on healthy housing. How do we make sure that we help create system and policy changes that will speak to improving the environment of healthy homes in New Brunswick? And so we know that in order for this to work, and we've doubled down on this fact, that you need the community to work with you, not for you, not for them, but with you, right? So that real sense of community engagement, which is why our community health ambassadors, who are residents here in New Brunswick, are an integral partner in the work that we do. And so they've helped, with helping to mitigate tenant landlord issues, with educating people on tenant rights here in New Brunswick, helping with making sure people are aware of tenant and utility assistance programs, which have been big, obviously, during COVID. But in a nutshell, we've developed a tenant association, which the community health ambassadors facilitate, where we create this space where residents come in and speak to see what commonalities they have in terms of healthy housing issues, right? We've developed through that a communications with the city of New Brunswick, in particular, the Office of Rent Control, which deals a lot with tenant landlord issues, to help us work together in order to, number one, mitigate issues, identify issues. And we're at a point right now, happy to report that we are working together to actually change policy. And so we are currently working with the city, with the Rent Control Office and the city planner, that in a ordinance that will address water utility, and water utility charges, which was something that our residents in the tenant association brought up as an issue. They were being overcharged water, and there was really no clear-cut guidance as to how things should be charged. And so we've been working with the city. We were able to give suggestions. We were able to support this. And again, happy to report that actually next week, it goes for vote at City Council, and we're actually going to have tenant association members going in and testifying in support of the proposal. And once passed, I'm being very positive to say that once passed, we would have a hand in a policy change at a local level.
That's awesome. The reason you were chosen to be part of this grant when we were picking our communities was because you already had such a strong community involvement, and we had recognized you from the Housing and Community Development Network for your health partnership as being a wonderful collaboration that did so much in the community. But you've just grown it so much by bringing the tenants more involved and really focusing on what their needs are, but also educating them and making sure they knew what was available for them and what was happening. So are they, the tenants at this point, are they able to connect with any of the hospital programs through what you're doing? Or, how is that happening as part of this growth?
Absolutely. As a major partner in our program with the hospitals, like I stated, our local hospital systems, Robert Wood Johnson University Hospital, St. Peter's University Hospital, we all know that once you start doing community work, even though your focus might be in one thing, right? So we're talking about housing. Once people see that they have your ear, that's not the only issue they're going to come to you with, right? Which was actually something that we were hoping for. So as we start to get their trust, right, and they start, sharing with us and allowing us to help them with their housing issues, then come the other issues, right? Health issues being one of them. And so having the hospitals as a partner has allowed us to create those referrals to those services that are needed on the health space, right? So we all know that housing is a social determinant of health, both indirectly and directly affecting health. Directly affecting health in the sense of your housing conditions are going to either exacerbate or create or develop issues that wouldn't necessarily happen if there were no housing issues happening, right? So an example is mold, right? And those people with respiratory issues. And so making sure that you are addressing the housing issue, but also making sure that they're getting the care that they need is important. And so we've made that connection. In addition to that, I want to definitely recognize Robert Wood Johnson University Hospital that instituted a medical legal partnership with Legal Services of New Jersey. And we have been able to provide legal assistance to residents that unfortunately their housing cases or tenant landlord issues now need to be resolved in the court. And why is that important for our New Brunswick residents? Because we do have a significant amount of people that are either low income and undocumented, and therefore do not qualify for legal services, because of their immigration status, and also don't have enough money to, let's say, hire a private attorney. And so in these cases, we are now able to provide legal assistance, and they're able to be represented by an attorney in these issues.
And there's so much happening in New Brunswick, and so much of it's based around the work happening from New Brunswick Tomorrow and the Health Collaborative that was formed several years ago. But I also know that through the rent grant, one of the things when we wrote this proposal was that we wrote to Robert Wood Johnson about how we could do this with a statewide perspective. And we chose 6 communities, and New Brunswick Tomorrow is one of the 6 communities. Working with the other communities that are all at different levels of where they are. You're one of the organizations that is the farthest ahead with what you're doing in this area. How have you seen that either make a difference for you or, helping others, or what do you see as a benefit from being part of that collaborative of the 6 communities?
So, kind of goes with that old saying that, 2 heads are better than one. And so understanding that perspective. So, I appreciate your words of our collaborative being kind of at the level that they're at, and maybe probably one of the more veteran efforts here in the state. So number one, for us to be able to share our experiences and in the hopes that helps, more, new and upcoming efforts is important. But we also get feedback and ideas and strategies from sharing a statewide perspective, because there's going to be differences, but there's also going to be similarities, and then trying to find those similarities to work cohesively, right? I think we can all benefit from each other, irrespective of where we are in terms of our efforts.
So we've been very lucky that the 6 communities have come together so strongly and meet and share your ideas. We've also been very successful in getting legislation put in place to make it healthier and safer for tenants throughout the state. And we're hoping to be able to replicate that and continue the work that we've been doing. What would you see as the next goal that you'd like to see out of this project going forward?
So one of the things that I've seen that I think has been of great benefit with this project is the ability to talk about local issues and how local issues can help inform what we should be concentrating on in terms of state policies, but also the opposite side of that, seeing how state policies best translate and how they affect are local issues, right? And so that importance of that two-way communication in order to really fall on effective policies that are going to be both beneficial on a state and a local level, I think is paramount to the work and the efforts that we've been doing. You know, I think the fact that we were all able to advocate for the eviction moratorium during COVID, allowing and providing opportunities for tenants not to lose homes, you know, as they were going through the pandemic, was vital. And that work hasn't ended. So, you know, the first thing in my mind is making sure that we continue to have those tenant protections as those moratoriums have now lapsed, and making sure that as Trenton makes their decisions, you know, that they recognize that people are still struggling, right? The pandemic is not over.
No.
And people are still suffering. And so I think that's one of them. You know, we talk about, you know, streamlining, let's say, applications, which I know is a policy that's being pushed. I think that came out of understanding and our comments on, you know, residents' experiences with trying to apply for these programs and how difficult that is, and the need for either patient navigation or a facilitation or making the applications themselves easier, right? So that people can actually apply and get the assistance that's needed. And so I think in the short term, there's that, but really, again, it goes back to what I think the high level need here is that there is a relationship between what's happening at the state and what's happening locally, so that it makes sense for both.
That's wonderful, Manny. Thank you. You know, we have the 6 communities, and I'll be talking to everyone and getting some information and feedback on where they are and what they've succeeded with. But you've been a shining example of why we're doing this work and why we've put so much effort into it and time, because it does make a difference for the people right there in your community, and make sure that people are living in a healthy and safe environment. So looking forward to continuing the work with you as we go forward on the rent grant. And we've been working on it for about 1.5 years. And if you remember, when we wrote this, the pandemic hadn't really happened yet. We actually wrote the proposal before the pandemic. And here we are, and kind of changed our direction a little bit, but the idea of overall health and safety has not changed. So I thank you for your hard work, and I thank you for all the things you're doing in the community, and we look forward to continuing working with you. Thanks,
Likewise.
Manny.
Thank you.
Okay.